Hi, and welcome everyone to the latest edition of the Reimagine Mobility Podcast series. I'm here with Adam Gross from HarmonEyes. Adam, thank you for joining our show. It's an exciting time in the automotive space, and at the same time, we need a lot of help in a lot of different areas to make the new technology safer and better as we reimagine mobility going into the future. So please explain a little bit to our listeners and viewers where you're coming from, what is your background, and then explain to us who is HarmonEyes and what in the world are you guys doing to help us reimagine mobility.
Yeah, first of all, nice to see you, Stefan. Thanks for having me. So personally, my story is I'm kind of an entrepreneur at heart, a number of startups. I'm kind of a veteran at this point. My last company I had sold in 2012, and as I was coming off of that integration, met my current partner, Dr. Melissa Hunfalvay, on the tennis court. She was a former professional tennis player from Australia, and we had a good match, and we wound up talking afterwards, and she was explaining how she was looking for a business partner to help her with her work in eye tracking technology. And Melissa was an eye tracking scientist at this point, now 12 years later, one of the leading eye tracking scientists in the world. And so it's an interesting concept, right? Basically, we founded our parent company, RightEye, and it was all based on the idea that there are decades of research that correlate someone's eye movement behavior to their vision, their health, their performance, and their attention. And the tool, the sensor used to measure that eye movement behavior is an eye tracking sensor. Now, back in 2012, eye tracking sensors were big and bulky and expensive. It's usually camera-based. And, thanks to Moore's Law, we're now down to, micro cameras and a chipset that can fit into really any device. And so the eye tracking sensors have proliferated. They're, dare I say, not ubiquitous yet, but they're becoming ubiquitous. And you're starting to find them in the cabins of vehicles, in the cockpits of aircraft. You're finding them in augmented and virtual reality headsets. You're now starting to see coming out of Asia glasses-free 3D monitors that are powered by eye tracking technology, also tablets and phones. And so back in 12 years ago when we started RightEye, we didn't have this environment where the sensors were everywhere. So we were forced to build our own product. And so we wound up developing a medical device that did objective vision testing, and we sold a lot of it to eye care professionals, neurologists, neuro rehab, a lot of elite performance customers like professional sports, MLB, NBA, and also elite military, special operations command, etc. And so over the last decade, what we've been able to do is we've been able to procure a really large data set of the largest data set of eye tracking data in the world. And at the same time, in order to power our medical device business, we had to develop a really robust eye tracking data analytics platform that took in the data from the sensor, and at the end of the 8th step, kicked out machine learning and AI models that delivered outputs that were meaningful. For a medical device, the meaningful outputs were objective information to do things like diagnose and also measure, someone's vision skills, for example, if it's a performance-based use case. And so about a couple of years ago, as the proliferation of these sensors started to grow, we started getting some phone calls from some of the big tier 1 tech firms who were developing the headsets, and driver monitoring companies who were developing in-cabin systems to monitor the drivers and also sense different aspects. And so what we kind of took a step back and we said, okay, what are the challenges here? And then we're going to solve these challenges. We don't want to build another solution in the, searching for a problem. We wanted to identify the problems and build to that. And so what we realized is that while the sensors were growing and there were some basic utilities that were being able to be deployed, such as attention and focus and things like that, where we shine is on that eye tracking, the AI modeling side. And so because of the data sets that we had collected, we were able to train models on that data and develop predictive models around other user statuses, things like fatigue, things like cognitive load, that, stress and things like that, anxiety, also targeting, where are you looking, situational awareness, a lot of performance-based outcomes. And so we started developing these AI models, and we created this company called HarmonEyes. We deliver these models. We're rolling it out right now. We deliver it in a really easy to deploy SDK. So you can deploy it at the edge, which is locally in a cabin of a vehicle or on a device. It doesn't require cloud technology. It's all under the hood, if you will, no pun intended. So that was the first problem that we solved. The second problem is that we quickly realized when a large tier one came to us and said, well, we have a 5-year R&D pipeline, and every use case and environment, we're using a slightly different eye tracking sensor, right? The sampling rate could be different, the precision, the accuracy, they all can be different. So even in their R&D world, if they want to deploy eye tracking functionality, every time they use a different sensor, or even if an existing sensor has a firmware update, for example, the specifications of that eye tracker slightly change or significantly. And so the eye tracking models have to constantly be revalidated and re-verified. And that is just a blocker for the entire industry, whether it's other driver monitoring system companies or it's the other application developers or the hardware manufacturers themselves. And so what we did was, about a year ago, we invented a solution called the A.C.E. It's an automated conversion engine. And basically what it does is it normalizes signal data from any eye tracking sensor to a standard and a format, a single standard and format, so that all they have to do is build to that one standard, and it doesn't matter when there are updates or when there's new hardware, it can operate. So it's really creating interoperability for eye tracking for the first time ever. And we really think that's gonna help the industry. So these are the two solutions, or two areas rather, that we're targeting.
Mm-hmm. Very interesting. You really created not only a model to identify the different scenarios of how somebody's eye looks and what information you can get out of it, but also that it's really agnostic to whatever hardware or sensor it's working with. It's interesting. So the one thing before I jump back into mobility, because basketball is dear to my heart, what would an NBA player need to know about his eye tracking? I mean, baseball, I get it. The ball is coming, you got to hit it. But basketball, what are we talking there? Fatigue or some of these other things you talked about? Or what are they trying to improve?
Yeah, so for sports, it's like military. You're performing different tasks. If I'm a point guard on the basketball court, I've got a different skill set that I need as opposed to someone that's shooting a free throw. Someone that's shooting a free throw, you're going to follow you need to fixate, right? And the science shows that you fixate on the front of that rim. So if we can identify that you fixate on the front of that rim, your percentage is going to go up. If I'm a point guard and I'm driving down the court, my scanning ability and recognition need to be really top notch, right? I need to be able to scan the court. I need to be looking for players who are open or who are going to be open as they're moving, where there's no defenders. And this translates even into military, right? Where our customers are starting to assess vision skills and steer certain warfighters in different directions. If I have strong fixation stability skills for long periods of time, I may have come in wanting to drive the Humvee, right? But I'm going to be better suited to be a sniper, right? And if I'm and vice versa, if I've got really good scanning and recognition ability and situational awareness, they may put me as driving the Humvee, searching for IEDs on the side of the road. So you can see how this translates to performance driving. And also everyday driving. These are skills that are absolutely needed, not just to mitigate risk, but to improve performance. And so, and I want to mention one other thing. So you start to think about maybe not the performance part that we just talked about, but some of the real critical aspects like overload and fatigue, right? It's not enough just to identify that, Stefan, you're fatigued. Like, of course you are. You're already experiencing it. Right? You probably are already suffering from the symptoms of fatigue, which is creating risk for you and others on the road. So one of the really amazing things that our models do is they predict it ahead of time. So there's a constant stream of you as a driver, and it's low, medium, and high fatigue. And so what we allow you to do, or the platform behind it, the driver monitoring system, is we actually give you the time predictor that if you continue on this track, then in, say, 65 seconds, you're going to go from medium to high fatigue. And what that allows the platform to do is to pre-program certain interventions or corrective actions so that you don't get to that point. So we've all kind of experienced, if you have a newer model vehicle and you have got the sensor turned on, that if you're kind of veering into the lane, you get the haptic feedback. I turn mine off because it happens all the time. It says get a cup of coffee, whatever it is. That's a responsive sort of feedback, right?
Right.
I'm already in the middle of the lane, so the damage may already have been done. So the beautiful thing about what we do is we actually can predict it ahead of time. And so we can prevent, that adverse effect happening.
You talk about projecting it, right, ahead of time, which to me could solve a lot of challenges we see today in level 2+ and level 3 type applications. I drive a vehicle with a level 2+, and there's sometimes this eye tracking is great, at least for what it does, right? Keep your eyes on the road or the system turns off. And sometimes it tells me, hey, you pay attention to the road. And I'm like, I am. I'm like laser focused, like I'm staring at the camera right now. I don't know what you're talking about, right? And then I figure out, is it my sunglasses? Is it a sun shining in my face? Or is it something different? I don't know. But back to the prediction ability, Adam, tell me, is this, are we talking, I can tell you that in 2 minutes you're going to be too tired, or you have a certain level where maybe an OEM wants to create an application that says, hey, we're concerned. What's the time you can predict it, right? I mean, is it something that is like an hour ahead of time? Is it 10 minutes? So share a little bit of light on that, on this very fascinating technology you have.
Yeah, so let's just take overload for an example. Our current overload models are predicting it about anywhere from 30 to 60 seconds out.
Okay.
And so, like I said, the way the SDK output is working is that there's a constant output of, Stefan is driving the vehicle and it's low, medium, or high. So you're in low mode forever, nothing's going on. You're great, right? Even you may be medium, but that's okay too. Right. And there may be an opportunity for you to create a custom setting, right? Or the manufacturer to create a custom setting. It depends on where things go. So you could have some control over it. But let's just say, for example, you're really concerned when you go from medium load to overload, okay? Because that's when bad things happen.
Yep.
And so we can predict 30 to 60 seconds out that you're going to experience overload if you continue on this track. And so what that allows, we enable is a pre-programming of certain corrective actions. So whether it's a haptic feedback, whether it's a physical reaction from the vehicle,
audible noise, something like that.
Yeah,
Sure.
exactly.
Yeah.
And I know we're talking about vehicles now, but I look at mobility, and that's in other environments as well, like aviation. Right? So whether I'm flying a Boeing 757 or F-35, I also want to know before I'm going to be overloaded, because now my risk profile is different.
Yeah, it's interesting. So then, and the industry has been challenged with, for the last 20 plus years that I've been at least involved with, somewhat of a driver monitoring. Back then, we didn't call it necessarily that, but oftentimes it was drug impaired, alcohol impaired. How can you not allow somebody to drive? Well, it's, a breathalyzer test, very elaborate, trying to integrate this into a car, etc. Are we talking with your technology, you can tell as soon as somebody sits in, he or she has consumed too much alcohol, has potentially a drug overdose, I don't know, potentially is close to having a heart attack even, or passing out? Are we literally talking that level of capability?
So from our perspective, the data does all the talking. That's the ground truth, right? And so I mentioned earlier that we've collected this massive repository of eye movement data. Now, we've got a large data set of folks who have cognitive load, fatigue, right? We understand situational awareness and all that because of the performance data that we've got. We've got a number of data sets around health and vision related issues. And so, and we haven't really gone down the path of creating, using that to create a clinical diagnostic tool, but we are talking to potential partners who would do that and partner with us, right? We create the models and they'd go out and create those diagnostic products. That being said, screening, right, and having those biomarkers are really important. And so some of the data sets that we've got where we understand if someone, for example, we know what the ocular motor function, which is the the micro eye movements, the signature of someone that is having a stroke, okay, or a migraine. We actually have a large data set around movement disorders, so things like Parkinson's disease. We've partnered with MIT, where we've collected data all around Lyme disease, and with University of Miami Medical School for mild cognitive impairment. So we do have a whole other clinical set of data where we can deliver predictive models for folks who start to look like someone who's having an active stroke. Yeah, and that's so hopefully that addresses your question. Now, are we ready to deliver it? We're ready to train the models and develop it. And really, at this point, because of our infrastructure, we can do it pretty much faster than anyone because we've got the data and we've got the data analytics platform, the AI modeling platform. So we could deliver a lot of those models in just months. We just need the right partnerships to prioritize it.
Interesting. And then let's quickly go back before I want to look forward again. I mentioned before in my cover example, I feel like certainly when I have sunglasses on, it's a little more challenging. I would assume, but want to know from you, to you, it doesn't matter if somebody has sunglasses or not. At least to your data and your algorithm, it doesn't. It probably depends on how good the camera is to try and get to the eye, right? To be able to see the eye. Would that be a fair statement?
That is completely accurate. And so what we do is we take in the signal data, right? The sensor has to work. We're assuming that in a vehicle, those sensors have been tested for years up and down in various environments. When the driver is looking left, right, we've seen environments where there's a sensor right in front in the dashboard, front facing, on the left side, on the right sides. We also are seeing, multimodal sensors, right, where they're also looking at facial patterns and they're looking at head movement, things like that. We focus on the eye movement. So as long as we get a quality data signal, or signal data, we can run our models. And it does not matter, even just speaking from experience with our medical device, which is a remote tablet device, we're able to track, and most eye tracking sensors are able to track through wearing sunglasses or corrective lenses.
Everything. Interesting. So then let's, again, to the true meaning of our podcast, Reimagine Mobility. What can you reimagine with this technology going forward? I mean, it sounds like you pretty much do already everything that, from an industry's perspective, is one of the challenges, right? Tracking eyes, preventing accidents, or at least giving even more advanced warning that an autonomous vehicle or a level 2 plus, level 3, hey, you may need to take over here and disable the autonomous features. What do you see next, Ed? I mean, where is this thing going next?
Well, for us next, it's securing those relationships that allow us to deploy these models that we've developed, and we're just starting to do that. And so we want to see our models out there in the world saving lives and helping improve performance and mitigating risk, and that's really what we're about. So the next year or two for us is going to be about, and we see it in two ways, right? We can work with vendors who are developing these driver monitoring systems. Right, they're building cohesive systems, and eye tracking is important, but they may not go as deep as we do in the eye tracking. So we can license our models to those folks, and so what I see is kind of a three-step approach, right? So the first step is some of the tracking of the user statuses, like things like fatigue and cognitive load, situational awareness, targeting, distraction. We call them basics. I know they're not. But what we're really strong at. The second part is kind of along the lines of what you talked about, is that if there are clinical issues that are happening to a driver, being able to anticipate that and taking appropriate interventions in order to prevent an accident. And we see that in all sorts of mobility. We also see it in the training side, right? So, dealing with big, heavy equipment manufacturers and machinery, right? Operators of that, maybe you don't want to take the earth-moving machine onto the quarry for training. You want to do it in an augmented or extended reality environment, so that if they have an accident, it's not ditching a $2 million machine and risking lives. And so we see it in the training environment as well. And then I'd say the third part is more of the tool which is what I talked about early on, which is what our A.C.E, our automated conversion engine, which is really kind of finally creating universal compatibility for eye tracking sensors. And so OEMs don't have to worry about, firmware updates and are my eye tracking models going to be valid, on a Wednesday at midnight when the driver gets in the car Thursday morning, are they going to be out of whack? And so if everything just works, it's interoperable and the sensors are all developed, all the models are all developed to one standard and format, then we solve a huge problem for all types of companies.
Right. So then let me, out of curiosity, I mean, we've talked to all sorts of different people, obviously, on this podcast, and we had one guest that talked about crash test dummies, right, that we use. And it used to be, it's one fake body that you use for any shape, size, or form of an individual, young to older, muscular, skinny, whatever it is. Is there a difference in eye tracking then, or in the information you have that you had to train your AI model for different nationalities, right? I mean, our eyes certainly look different than the eyes of people from Asia originally. Different skin colors, female, male, older people, younger people. I know we maybe go more into the medical field right now a little bit here, but very interesting. Is that all incorporated?
That's a really good point. And you're right. We didn't go that deep on our data sets, but it's really important to understand what the normal population looks like. So our normative data set for those who are interested is like over 250,000 people, right? So, and it crosses over different ethnicities. It crosses over handedness, left and right handedness, eye dominance, age. It really crosses over everywhere. And so we like to say we understand what normal is across all different types of people and the entire population. And so if you understand what normal is, then it allows you to train your models better. And when it comes to different eyes, and there are around the world, that really comes down to the hardware sensors. And we're assuming that trackability, if you will, has been tested in the lab before we get the signal data.
Sure. So maybe two more questions. Second to last, what really enabled this for us here to reimagine mobility, which it sounds like you're at the onset of really changing mobility, at least as it relates to driver monitoring and safety, et cetera. And again, not just in the vehicle. I'm thinking heavy-duty trucks, right, where driver fatigue is always a concern because you're driving a big vehicle that can potentially create a lot of damage. But what really was the enabling technology is the advancement of deep neural networks, of deep learning to really train the data, because I assume the data you can collect, it's a matter of time. Again, 250,000 plus people. But is it, again, the deep neural networks that allows us to do now to train this much more efficiently, and not just a pure, I would say, machine learning piece, right? Is it the sensors? Is it the smaller, higher, more powerful compute platforms or processors? Share a little bit of light on that.
Yeah, so another really great relevant question. So we're at the point now where for most of our models, we don't need more than a 30 or 60 hertz sampling rate. So it's pretty low. We can generalize it all the way down. I think what's really critical and what we've heard from some really large technology companies is that, part of the last decade of what we've built, and we built it to power our medical device business, and we almost didn't realize what we were doing. But we built the only 8-step eye tracking data analytics platform. And it's an 8-step pipeline. So imagine the first step being just capturing the signal, right? You just got to get the signal. But once you get eye tracking data, and for anyone out there that has dealt with eye tracking data, maybe not most of you, it's really, really difficult data. So it's XYZ coordinate data. It's oftentimes, collected at a rate of 100 to 200 times per second per eye, right? So you're getting a lot of data. There's a lot of noise in that data because eye tracking in the wild, especially while you're driving, as you said, you've got sunlight coming in through the sunroof. You've got people wearing glasses, all these different environments. they're moving. So it's important to be able to filter and classify that data. So we have to take that raw data. We have to understand some of the foundational metrics, like what is a fixation? What is a saccadic eye movement? What is a smooth pursuit eye movement? Just from the raw data that we're getting. So that's the first phase. We call it kind of signal capture and analysis. The second phase is feature generation, this is where we've developed 7,000 algorithms and being able to start understanding, okay, what do those mean, right? What is that eye tracking feature? What are those, the fixation and the saccadic eye movements? Where are they located? And starting to make sense of it. And then the third part of the pipeline, which the last 3 steps, are deploying machine learning techniques, which really for the majority of the last 10 years is what we've been doing. And then with the advent of AI modeling and deep learning, we've deployed those tools now and do it using a lot of pattern recognition. So that's where we are. So you go all the way from capturing the signal in one single platform, mind you, all the way to machine learning and deep learning and AI model outputs in real time, delivered through an SDK that's at the edge. So it's very low compute and very low power consumption. And it's easy to deploy and it's seamless. And we believe we've got the answer to help with a lot of these solutions.
It's fascinating stuff, I have to say. Adam, last question. Nothing to do with eye tracking. Well, maybe does a little bit, but what's the next car you're going to buy and why?
So this is timely because I'm ready. And I've kind of migrated. My kids are a little bit older now, so I've migrated from the SUV to the sedan. I've got an Audi sedan. And I really love my Audi sedan. I just love Audis in general. My son really wants me to get the Rivian, the newest Rivian SUV. I'm not quite sure I'm ready to go electric yet. I probably would have gone electric last time, but the Tesla, it doesn't catch my eyes much. I know they're great, and I've driven my friends, and they're amazing vehicles. But just the look and feel of it for me. I would probably say that I won't be as bold to do what my son wants me to do and go with the Rivian, and I'll probably just, get another sedan.
Excellent.
Don't be disappointed in me, I know.
Nobody's disappointed here. It's just a very interesting last question, I have to say, because we get all sorts of with answers, and yours is, again, makes a lot of sense. I mean, very, very reasonable logic here. Adam, thank you so much. It's been truly fascinating for me to learn about this and understand how far this technology already is and what you can do with looking at somebody's eyes alone. Thank you so much for your insights.